Hi, I'm Lily Bush, Home Oxygen Nurse with Nottinghamshire Healthcare NHS Foundation Trust. This training video is to help you access information when you have questions about patients who you may feel need assessing for home oxygen. This is to target community clinicians in Nottingham and Nottinghamshire CCG who are considering home oxygen for patients, and all NUH ward staff who are considering discharging patients home with oxygen. Regardless of a patient's condition or prognosis, oxygen therapy is indicated for hypoxia. It is not for breathlessness in non-hypoxic patients. This includes palliative patients. For breathlessness, patients must be offered the appropriate treatment in the first instance. For example, inhalers, opiates, respiratory physiotherapy, anxiety treatment, nebulizers and fan therapy. Oxygen, when delivered at 100%, is a drug and carries risks, not just to patients but others around them, and it must be assessed for and prescribed appropriately like any other drug. You must determine the appropriate target saturations for the patient. For example, aim for saturations of 88 to 92% in COPD or less than 94% in other conditions, including palliative patients. Before considering home oxygen, patients must be clinically stable and have all their other treatments optimised. In COPD patients, oxygen saturations should be persistently below 92% on air and at rest. In other conditions, oxygen saturations should be persistently below 94% on air at rest. If this is the case, they will need to be referred for an arterial blood gas assessment. This is to determine whether they meet criteria for long-term oxygen therapy, or LTOT for short. If you work in the community in the South Notts area, please see Chapter 2 on how to refer to lung function at City Hospital for this assessment. South Notts is Nottingham North and East, Rushcliffe and Nottingham West CCGs. If you work in the community in the Nottingham City area, please see Chapter 3 on how to refer. Arterial blood gas assessments measure the patient's oxygen levels and also their carbon dioxide levels. Some patient groups are at risk of type 2 respiratory failure when receiving supplemental oxygen therapy. For example, ex-smokers, COPD, obesity, hypoventilation and neuromuscular disease. To meet criteria for home oxygen, patients must have a PaO2 less than 7.3 kilopascals in COPD and interstitial lung disease, or a PaO2 of less than 8 kilopascals in other conditions, or COPD or interstitial lung disease with cor pulmonale. There are risk factors to consider when considering referring patients for an oxygen assessment. Consider the type of type 2 respiratory failure, as mentioned above. Never prescribe oxygen to smokers or to those who quit within the last 3 months. Use caution in those who have smokers in the property or anyone who uses e-cigarettes in the property. Patients should not store or use oxygen near naked flames or flammable substances, for example oils, paints and grease. If patients require the use of emollient creams, they should be switched to Epimax oatmeal cream. Use caution in patients who are prone to hoarding. Check their risk severity by completing the MHORT, which is the East Midlands Risk Assessment Tool, or the IHORM, which is recognised nationally. Use caution in patients who are on sedatives. Use caution in patients with poor mobility or who have poor or fluctuating cognition. Oxygen tubing can be a trip hazard. If you have any doubts, make a safe and well referral to the relevant fire services. Please see the details of all the East Midlands fire services. For those who do meet criteria for home oxygen, have a discussion with them to counsel them about this. They may require long-term oxygen therapy forever, and this can serve to make people very anxious and scared. Advise them that oxygen therapy has been shown to have life-prolonging benefits and increase quality of life. However, the oxygen may just be required temporarily to support them until they are well enough to be weaned off it. They will be followed up at home within 1 month by the community oxygen nurse or respiratory nurses once they have started their home oxygen. If a South Notts patient has been discharged from NUH with home oxygen, ward staff should refer them for a follow-up LTOT assessment in City Hospital's Lung Function Department 8 weeks post-discharge. Please ensure that you notify the oxygen nurse when the oxygen has been commenced or changed. See details in Useful Contacts in Chapter 5. Whenever a patient is being discharged from hospital with a change to their oxygen, you must amend the hoof. Please see Chapter 4 on how to do this. You will not be able to order ambulatory oxygen. This will be assessed for in the community. If you work in the community, you refer for an ambulatory oxygen assessment in the same way as for a long-term oxygen therapy assessment. Please see Chapter 2 if you work for South Notts. Please see Chapter 3 if you work for Nottingham City. If a patient in the community is unable to attend lung function and you are confident that they meet criteria for home oxygen, then complete a hoof Part A and let your oxygen nurse know when you have done so. See Chapter 4 for how to do this.